So good morning, good afternoon, good evening. Thank you for the invitation. My name is Dr. Ali Bazarbachi. I work at the American University of Beirut in Lebanon. So I will be presenting actually from the ASH 2020 meeting, a very interesting abstract on successful and safe treatment of intestinal graft versus host disease with pooled donor full ecosystem microbiota biotherapeutics. So this abstract was presented by Dr. Florent Malard from Hôpital Saint-Antoine in Paris, France. So as you know, the gut bacteria has been shown in many studies to be associated with outcomes of allogeneic stem cell transplant. And there have been a lot of developing strategies to address the microbiota injury in allotransplants. And among these strategies, we have the probiotics, including fecal transplant. So as you know, treatment of gastrointestinal acute GvHD is an unmet medical need with 38% of patients failing to respond to ruxolitinib at day 28, particularly in the setting of steroid refractory GI acute GvHD. So fecal microbiota transfer was proven to be safe in highly immunosuppressed patients, and promising results were reported for fecal microbiota transfer for steroid refractory GI acute GvHD in case reports and the small series. So the abstract I'm presenting, was about MAA-T013 full ecosystem therapeutics, which is a standardized off-the-shelf way of doing fecal microbiota transfer. And so this product is manufactured under GMP conditions, and in general, it's delivered by direct colonic delivery through enema. So the abstract was about the compassionate use expanded access program of this product in France between July 2018 to July 2019. So as you know, we have the Heracles clinical trial, which is ongoing for steroid refractory GI predominant acute GvHD grade 3-4, where MAA-T013 is used as monotherapy in first line after steroids. But for non-eligible patients, we have this expanded access program that was performed, and the data presented about 29 patients, mostly with acute myeloid leukemia or myelodysplasia, who had steroid resistance in 3/4 of them, or steroid-dependent acute GvHD for 1/4 of them, and mostly classical acute GvHD. So 93% of the patients at the time of fecal microbiota transfer request had grade 3 acute GvHD according to Glucksberg criteria. And organ involvement, 100% had gut involvement, 24% skin, and 17% liver involvement. So 3/4 of these patients with steroid refractory acute GvHD had used ruxolitinib before, and the median number of MAA-T013 administered was 3, and the route of administration was enema in 97% of the patient. So regarding response rate, 59% of the patient responded including 31% complete response, 21% VGPR, very good partial response, and 7% had partial response. And the best GI response until day 28 was 69%. So again, 31% complete remission. And interestingly, in the subset of 22 patients who were resistant to ruxolitinib, response rate was again 55%, and best GI response until day 28 was 64%. So overall survival for in all patients, we had 6 months and 12 months overall survival of 52 and 46% respectively after a median follow-up in a live patient of more than 10 months. And similarly, even in ruxolitinib-resistant patient, 47% 6-month survival, 39% 12-month survival. So safety data, very interesting safety data, possibly related sepsis 1 day after the 3rd dosing in 1 patient only with no pathogen identified in blood culture. And so no alerting safety data in this series of 29 patients. So the proposed mechanism of action was that MAAT013 restores microbiome diversity, regenerates gut barrier protective effect, and significantly curbs inflammation. So in conclusion of this study is that MAAT013 is effective for steroid-resistant, steroid-dependent acute GvHD with a high overall response rate of 59%, including 31% complete remission rate, also effective after ruxolitinib failure, and safe in highly immunosuppressed patients with only 1 possibly related sepsis. Thank you for your attention.